to make that invitation. We are going to present a session with a specific experience, a real experience of Osakidetza. It's a Basque Health Public Service, and it's very well aligned with the last arguments, with the last discussion from Vanessa. So what we want to share with you is to show you how Osakidetza is supporting the healthcare professionals from Osakidetza in developing mHealth solutions that respond to the challenges of the care. We want to provide these mHealth applications in order to be from an holistic perspective, covering all the process, trying to improve the effectivity of the care. And Osakidetza wants to be there and is going to be there from the beginning to the end, supporting all the process, supporting the professionals, not as an sponsor, but supporting them. Because the final aim is that those applications and health applications are used in the Osakidetza, of course, and they can be used for the improving of the care and also to improve the sustainability. So this work is led by Nicolas Gonzalez from Osakidetza Basque Health Service, and is going to be presented by my colleague Anna and I from the Digital Health Group from the Institute for Health Services Research, Kronikgune. Nicolas is attending also the meeting, so the webinar, so he can be joining us. So
Dolores, sorry to interrupt. You're not yet sharing your presentation. You're sharing your screen. I'm not sure whether that is on purpose or not. I just wanted to let you know. Also, thanks, Mark, for the comment. Now, okay. Thanks.
So this is the index. First, a brief view about what is Osakidetza, what are the governmental framework that is supporting the mHealth, what has been our reflection, our previous reflection, what are the framework for action, and then in the framework for action, we will highlight some specific aspects of priority areas, some success stories, and of course, the aspects that we want to continue working on. So the Basque Country has a high level of self-government. We have a Basque Parliament, a Basque government, with major of our legislative and executive powers, including the education and health. So Basque health system, as in the rest of Spain, is financed by taxes. It's a very rich model. That means that it's universal. All the citizens in Basque Country have access and have rights to be cared by the Basque health system. Osakidetza is a Basque health service. It was founded in 1983, and it takes care of a population currently of more than 2 million. This is some figures about what Osakidetza is. We have 13 acute hospitals, 3 emergency coordination centers, and 1 general transfusion and tissue center. And it employs more than 30,000 professionals. Most of them are public employees. So the Basque government, the Ministry of Health, has developed a strategic framework for the period from 2021 to 2024. And that framework allow us to incorporate the technology at the service of more immediate and accessible care for people. So within this framework and with incorporation of the new technology, we try to improve the care of the patients. We want to improve the recovery of care, and we want to improve the sustainability in such a way that we can see how well-sized we are, and also we can decide what are the exploitation of technologies that we could use to for a better streamline and improving of the care. So this framework offer a lot of things, but one of the things is the instruments that we can use, and one is e-health. And within e-health is mHealth. Some of you have already mentioned how important is the society we are living now. We are living in a more day-to-day, a more digitalized society, where everybody has, most of everybody, but many people has smartphones, and they are very essential devices for the daily life. So the mHealth in Osakidetza Now I want to highlight, some of the progress in Osakidetza regarding the mHealth. First of all, it's a reality. For Osakidetza, the development of the new technologies to improve access to care and health is a reality. The second point is that the instruments that are needed for this kind of healthcare are already provided. We have smartphones, we have tablets, we have other personal devices, and they can be used for other uses as new therapies or other things that we think that are used. Another thing is that the information that we already have is being expanded and broadened through the application advanced capabilities, because we want to get a better, more accurate and personalized clinical care delivery. And here I'm talking about clinical decision support and intelligent alerts. And finally, the personalization of care requires real-time data, and Osakidetza is very aware of that. So Osakidetza mHealth solutions are framed within a timeline in a defined protocol. That protocol has a temporary consultations follow-ups. And it's very important that the data that is introduced in that mHealth is going to have a consequence. So let me stop here, only a brief presentation of the different agents that are important in the research and innovation in the Basque Country. Here you see Osakidetza, and below Osakidetza are different institutes, are the executing agents, as one of them is Kronikgune. So what has happened in Basque Country since 2016 is that many of the professionals that have been taking part in the research projects led by these bio-institutes, by these executing agents. And this participation has, in European projects, initiatives, national projects, whatever, this participation has led us to think about what is the innovation, new ideas, to know what others are doing. And it has had a big consequence. It has been a progressive growth in the number of individual initiatives by digital skilled professionals that are interested in developing mHealth projects. So, well, we have professionals who have ideas, professionals who want to use mHealth applications to improve the efficiency of their care delivery, to solve some challenges. Now we have to see how to deal with that. And here, Osakidetza had a discussion about how to progress. Sometimes Osakidetza was knocked at the door by different manufacturers, showing a portfolio of different applications and saying, please, would you like to check, would you like to homologate or give us a kind of seal quality seal, something like that. And then Osakidetza didn't know anything about those applications because they were not theirs. So Osakidetza thought in that moment, we are the Basque Health Service. Why not we do design and create our own applications to be used by our own healthcare professionals and by our own patients? So here it is. Some of the professionals could be felt that they were a little bit overwhelmed by the by the mHealth wave, but they were sure that they had an initiative and an idea, but they, of course, had to be with someone else to go further. So the presence of the IT people were crucial because they have to solve a lot of things and they have to learn a lot of things about regulation that they didn't know. So we had to create a common framework in order to move forward. Some of the questions that the professionals made themselves was this: how to achieve the effective treatment for thousands of patients, how to meet the needs of clinical practice. So Osakidetza, to ensure that we were able to perform the whole process in-house, from the design, the implementation, and the put in place, and the diffusion or dissemination among the organization, define or establish a framework to support that process.
Thank you, Lola, for giving us this scenario. So now that we know that Osakidetza already had interoperability, expertise, they had infrastructure, they have this envisioned for new mHealth applications to be developed, we needed a framework for action. And this was covering from capturing the idea to fully deploy any kind of solution of initiative into a corporate solution. For this, we needed stakeholders that were devoted to assist in the identification of those corporate initiatives. This was key for getting the ideas burning in the different clinics, in the different settings, into a common framework to work and to develop. We then have also the promotion of synergies between entities and initiatives, because with these champions, we could see a broad view of what was burning in our settings, so that we can avoid also duplications and efforts that don't lead to final solutions. And we also had these key stakeholders to identify what it has been presenting all along this morning regarding the technical and regulatory needs. So we need to comply with multiple regulations, we need to provide ethics orientation, and we also need to give evidence on the validity of our solution. So these key stakeholders also needed to give them advisory support on the final design of the solution. And this might also result into an in-house development, or maybe at this point, we consider that this is too big for us for an in-house development due to the risk, due to the safety concerns, so that we needed to scale it up to external experts. But for this presentation, we will keep on those in-house developments. So we will focus on how the advisory support on the final design of the solutions stays in Osakidetza. And finally, but not least, we need to follow up and sustain all the initiatives, because this is key for building reliability and trust on our organization. The main strategy for all these solutions would be an open source strategy. So let's see how this is translated into concrete success stories. We have a framework for action for a new idea. This was the idea, a new methodology for the treatment of childhood obesity. We must say that this idea has been around for 2 years until it was captured by this framework for action and developed. So once we identify this opportunity, we must analyze the feasibility. And it goes from justification, requirements, it also needs a market evaluation and the analysis of the clinical, technical, and economic needs. And all of this is put together into a report, which is presented to the evaluation committee. And there's then a pitch. You need to defend your project and your idea in front of this evaluation committee, which finally gives the approval. If this approval is provided, then what happens is that a working group is created, and then there is a sponsor behind participating on this development. There is a budget, a specific budget in Osakidetza devoted for digital solution development. And when we talk about a working group, this is a multidisciplinary team that comprises multiple specialties. And in the case of this methodology for childhood obesity, we count with primary care nurses, specialists from psychology, psychiatry, and also designers, developers that join together into working groups for elaborating the contents, drawing the technical specifications, and preparing all the privacy impact assessment reports. All of this led to the preparing the security and the safety of the solutions. So with all of the working group on board, what we do was to construct the solution, meaning the development, a control activation, and a key part, which was the preparation of the training material for professionals. This preparation, as we have said, all kind of modifications of new methodologies have an implicit culture change that led to changes in the languages, changes on how to approach patients, learning new skills, developing skills, and getting closer to those mHealth paradigms. Once we have taken into account all of this, we will go for the first evaluation under this controlled activation. This application succeeded, and we followed up with the implementation, the extension, and the evaluation of the solution. This implies also a dissemination within the organization of this new methodology for treatment, and more important, a support and a continuous evolution based on feedback from users. So this Mangles Journey, it's a treatment for overweight and obesity in 7 to 14 years patients. The main pillars were the serious game, motivational consultations, and the integration with electronic health record. And it was designed to be used by different professionals at all care settings. This is key because behind all digital solutions, we still need to provide for patients the trust and the assurance that there's a professional behind following up all the process. This Mangles Journey works on physical and emotional health, empowering patients and families to promote change and behavioral changes. And it has been proved that it has been evaluated the effectiveness of the time consultation, and it improves. And it is easier for professionals to enter and follow up the patients with the key information. And just to give you some figures on the kind of assessment and on the kind of evaluation, it has been implemented throughout the organization this past year. And we have enriched 140 families with positive evolution in the body mass index. All the process, so from the moment that we have the idea, we have identified the idea, to this final implementation took over a year, more or less. Another success story that we would like to bring to the table is one that it was promoted internally for professionals. So instead of providing a solution engaging patient, in this case was a development for the internal use, and it was a mobility strategy for nurses. The idea here was to bring the symptom recording to the patient side. So nurses, whenever they go and assess the patient, they will be able to digitally identify the patient and report all the symptoms in the same place that they are asking the questions, that they are interacting with the patient. Mugitsen combines patient safety, nursing care, mobility, collection, and recording of information. This application goes for signs, medication administration, device on wounds, blood draws, bed maps. It's a data console built to inform about the activity there's a data console, built to inform about the activity with the different tablets, with different apps. And it is mainly a basic tool to allow quality record online and in real time. The main advantages is the security. It avoids identification errors and allow direct access to the electronic health record. This platform, as I mentioned, for the open source strategy, it's 100% open source. And it is creating a digital culture in the use of resources in hospital. This precise solution was also translated for home visits. So whenever the nurse goes to the patient's place, it can also, she or he can bring the tablet with them and report the signs and symptoms in situ without the need of going back to their clinic and re-entering all the data into the system. So now that we have seen some of these success stories, some of these, and the path that they need to follow, as we have seen in other cases, we need to set priority areas for initiative, balancing the objective risk, the initiative risk, and the resources that we had available. For this, for example, we set the priority areas for virtual therapy and treatments, and also clinical guidelines, procedures, and pathways. So there is a crescent interest on these digital solutions. We now can talk about an initiative for pediatrics and emergency room visits. There are programs to help you to stop smoking. There's also some initiative to incentive and provide information for blood donors. There's also a risk scale of, so the digitalization of risk scales, such as the ones for preventing and predicting the ICU entering. And all of these necessities required of a special attention and to go through this pathway. And this means that there are initiatives which are in the idea stage. We have some others that have been already prototyped and I seek for approval to be part of this portfolio, corporate portfolio, and some others have already been implemented and are part of the daily care. So now that we have all of this ongoing, we know that there's much more to keep on going. And the main part is that the framework is a tool that tries to to give governance of all these interests. But we need to improve this analysis of feasibility and opportunity, proposing exhaustive points on cost effectiveness, the regulatory roadmap, and even the implementation cost. We need also to keep on developing the electronic health record in order to boost the decision support tools. And we also need to enhance the visibility and the outreach of the framework in order to capture all the initiatives that are being growing in our settings. So this new context led to personalized attention time and increase the perceived care quality and reliability on the organization. And this is the main reason why we are investing so much time in this framework for action. So thank you all for participating in this workshop, and thank you for inviting us. It was a pleasure, and we are here to answer any question that may arise.
Thank you both. I think it's, yeah, again, very valuable to learn from that, like clear action points and to see actually what it can change. So thanks very much for that presentation. I open the floor again for any immediate questions. I mean, we have done all presentations now, so we can also smoothly go into the discussion slot now. But maybe first on some concrete questions for Dolores and her team.
if I may again thank for another excellent case of systematic approach to mHealth development, development of applications. Maybe I may have one question. Do you have any policy towards the third-party applications? That means market developed something and now it's associated with information that it really helps in a particular disease. Do you have any policy towards these applications in Basque Country?
Well, I don't think so. The strategic framework supports the e-health, and the mHealth is part of it. But it's not. It's something that is a response to the initiatives from the professionals. So maybe some diseases are more fancy, or the healthcare professionals are more digitalized, or more skilled digitalized. So maybe they are offering more proposals, but there is not a specific line to go through that.
And regarding the developments that are outsourced, it will be the ones that imply high risk and that needs high resources. So an example could be an application that from a face picture can help deciding on which is the anesthetic therapy that will be better for that patient. So all applications that have an intrinsic risk due to the objective, and also that it might be more invasive, an invasive therapy that will be outsourced to the experts who normally are providers of those digital systems, or instruments, medical instruments.
Thank you very much. Mark, you have a question.
Thank you, Sonia. Hearing the question from Zdenek about third party, I think it's the perfect illustration on the difference between a Bismarckian system and a central systems like in Catalonia, in Basque Country, like in Spain and in Italy. And here, to me, the very question that we have from a Bismarckian system point of view, and the question here is, what is to be done at the level of the ministry, at the level of the healthcare, of the regulator of the healthcare system? And here I heard the framework for action that was presented by Osakidetza, which is typically something that is that would be or could be under responsibility of a ministry. And we also had the interoperability framework that was mentioned by Carme, by Tixalut, and mConnecta as an infrastructure. These are elements that are typically a responsibility of a ministry in a Bismarckian system. It may be different time to time, because Zdenek, you mentioned that Czech Republic is a modified Bismarckian system, so things may change. But meaning what? Meaning that the story of the child obesity app of Osakidetza, or the one for the nurse, and the story of the diabetes patient from Catalonia, they are examples that in a Bismarckian country would be applied by hospitals, or by the national, or by the Olomouc University, so by actors, by clinical actors in a Bismarckian country. So here we have good examples of these two elements, but we need to pay attention to the fact that in a Bismarckian country, these two type of activities, so I would say infrastructure activities and service activities, that they are often distributed among different stakeholders. And I think here, now back to this question on, since this is a workshop for Czech Republic, the question here for the ministry and for Czech Republic is to define precisely where the ministry is willing to go, what would be the type of action that the ministry would take care of, and what type of action they would left to stakeholders, to actors. So that's at least the way I would, or the message that the take-home message that I'm getting out of this discussion.
Yeah, coming from Germany, I would very much agree with that. I mean, I often sometimes have the feeling that these systems are much slower, so the Bismarckian systems, but then, I mean, if you take the DIGA for Germany, as soon as they have made a decision, then things can be rolled out quite quickly and then nationally. But yeah, I mean, every system probably has its challenges and opportunities, I guess. Any further questions to the colleagues from Osakidetza? I actually had one. I was wondering, it relates a bit to the discussion, but it's more specific, whether any of the applications you have developed and tested for your needs and preferences, whether one of these applications has been scaled up to another region or like copied. I know it's not copying, but yeah, transferred to another region or even country, or whether that is something, yeah, you just don't do for the moment.
So it hasn't been scaled up as far as we know, although all are open source. So the project itself, it's already available. I think at this moment the main constraint is that they are in Spanish or Euskera, which is the Basque language. So the constraint will be more on the